What's going on YouTube? It's your boy CaliCoda or Nurse Coda, whatever you decided to call me is up to you. I go by both, so either is fine. So today I kind of want to talk about an update on nursing school and more about motivation and keeping motivated. So I'm gonna move this camera up a little bit. And staying motivated during the nursing process, right? Like during nursing school, during clinicals, and you got other people that you may not get along with, or aren't very good nurses, or just don't really care or don't want to really be here in the program. And it's kind of hard to deal with those people when you're trying to stay motivated and you're always hustling and trying to find something to do and asking all these other nurses. That's why you have a better rapport and things of this nature, and just focus on that, right? So focus on the fact that you're getting more training and and focus on you. Don't worry about anybody else. Nobody else's problems are yours, right? So whatever your weaknesses are, focus on those. Study those. If you're weak on pharmacology, study pharmacology. If you're weak on cardio, study cardio. And then run through flashcards, and then go get a test bank, and then run test questions and stuff like that, right? Okay. So back to the motivation and stuff like that. When you go to clinicals, one thing that I really want to stress that I feel like a lot of nurses have lost, right, is the fact that a lot of nurses can't put themselves in the position, at least nursing students can't put themselves in the position of the patient, right? So like, you need to look at this patient and understand that that's somebody's mother, grandmother, daughter, whatever, father, son, husband, whatever, right? So I'm just going to bring up a quick little story. So yesterday I was at clinical. Sorry, my kids are here, so I keep looking over to make sure they're taking a nap right now. So I'm trying to do this while nap time's going on. Anyways, so my story is, we had a 40-ish Hispanic male come in from the ICU for a withdrawal on alcohol, and this CNA who's talking to me about my nursing school and stuff like that. Granted, this is only a CNA, but she's going to school, she's almost done, and everything like that. And she's like, I just have no sympathy for this patient. And I can understand where she's coming from. I don't know her background. And then she proceeds to tell me that, she has family who are alcoholics like this, and she just doesn't have any sympathy for them or drug users. And I can understand that. I can get where she's coming from, but at the same time, you have to understand that that's somebody's father, son, husband, whatever. And treat them with respect, and don't treat them as commodity, right? Don't treat them as just something to do. It's a privilege to help these people and help heal these people for whatever illness or treatment is needed. Perform that to the best capabilities at the most professional level with empathy and care and kindness. And that's pretty much all I have to say as far as that goes. Without those things, I don't think that you should be in the nursing field. That's just my personal opinion. Now, you can take it or leave it, and that's perfectly fine. If you disagree, you can tell me. I don't mean any personal judgment or anything like that. I just feel that you're in the nursing field to help people, not just be there for whatever because it's just something to do. Okay? So please keep that in mind when you're going in. Sorry, I got a little off topic, and if that's a little negative, I apologize, but I'm just trying to stress that get in the mind frame of being positive and empathetic and everything like that, because it's going to allow you to achieve so much more success and happiness in life, and you'll be better off for it, and your friends will be better off for it, your family will be better off for it, and you'll have a better life and a much healthier life, because stress does cause issues with the body as well. Now, as far as dealing with other people, as far as like your cohort, or maybe you don't like that instructor that you have, because like myself, I've had multiple instructors, okay? I've had 3 or 4 different med surg instructors. I've had probably 10 to 12 different clinical instructors. So I have no set like guideline, right? Like we have like our normal like spreadsheet for head to toe assessments and stuff like that, and for our vitals and for our charting and medications and for your care plan, right? So all this is in like a packet. That packet has changed like 3 or 4 times. So I have no balance, right? Like there's no structure, okay? So I have to develop my own structure. So what I did is I made my own way of, regardless if they give me the handout, okay? So regardless if I had that handout, or regardless of if they come prepared or not, I'm always going to be prepared. Even if I don't have that piece of paper, I know what's on that piece of paper. I know that I need to check if you're alert-oriented ×4. I know I need to check your CMS and your neuro, and I know I need to listen to your heart sounds and your lung sounds. I need to do this full assessment, right? So I know everything that's on there. So as long as you can do that, if you can do that and just write it out on a piece of paper, on your own, you'll be able to, when you look at that piece of paper, like you're going to run through your assessment and then you're just going to be able to jot it down. Does that make sense? So focus on that's how I learn, right? Is by doing and making something that works for me. Not everybody's like that. Some people need templates. Some people need slideshows. Some people need to like just listen, right? Some people are like that. Everybody learns differently. So it behooves you to, is it behoove or behoove? Yeah, whatever. Just find whatever works for you, as far as like your assessments and care plans and stuff like that, because that's going to help you in the long run. Like how you start your clinical experience, how you start learning your routine. Like, I'll give you another example real quick. So for instance, the first thing that I do every time I go into a room, I knock on a door, I say hello, I introduce myself, I put on my gloves, and I proceed to talk with my patient and explain to them who I am, what I'm doing here, telling them I'm just coming onto the shift, ask them how they're doing, if they're feeling any pain, get a quick little assessment, right? Take their vitals, just figure out what's going on. Even before I look at the chart, like obviously I'll know the patient's name and I'll know a general basis of what's going on, but I won't have it like all written down and like secured or anything like that, because that's not important. I care about the patient and what's going on with them right that second. As soon as I come on shift, I want to know if anything's wrong. I want to know if the nurses have taken care of them prior to. Obviously, I'm gonna get my report from my other nurse, from the nurse on the prior shift. But I also want to talk to the patient, because where I was at is a clinical ortho, pre-op, post-op patients and stuff like that. So I always just check on the patient and see how they're feeling first. That's the very first thing I do. Doesn't matter like anything else. That's the very first thing I do to start my day with every single one of my patients. I go in and talk to them for like 5 minutes. I give them each like 5-10 minutes at a time, talk to them, figure out what's going on, see how they're feeling, take their vitals, just get a good concise picture, so that when you're charting, you can make a definitive picture, so that when the other nurses or the physician or the CNA or whoever is going back and reading this chart, you put that in the chart that you went in there at the beginning of your shift and all that stuff too. So your charting even looks better. Like that's just something that I do though, right? So again, that's something that everyone needs to find out, but I strongly recommend focusing on getting your routine down and focusing on learning your assessments and your care plans back, forth, sideways, diagonally, crisscross, Charlie Brown, however you want to do it. I don't care. Just figure it out and be on point at all times. And then once you do that, then you focus on your meds, and then you take your meds just as seriously as everything else. Because once you got the baseline, then you can focus on the bigger picture, right? Once you got the the small stuff out the way, then you got the bigger picture. But thank you guys. I know this video is getting a little long, so I'm gonna cut it off here. I want to say thank you so much for watching and liking, commenting, and subscribing. If you do or don't, feel free, please. I appreciate all the support. And if you don't like the videos, I apologize, but you know what? I don't really care. This is my vlog and it's my view on nursing and life, and I'm preaching positivity and motivation and optimism, and that's where we got to go in life. So I'll see you guys in the next one.